retiree. My name's Lindsay Price. I'm going to be your occupational therapist completing your evaluation today. So first, I just want to review some of the information I have with you. I see that you fractured your right humerus 4 weeks ago, is that correct?
That's correct.
And secondary to that, you're experiencing a radial nerve injury.
Correct.
I also see that you have a history of fibromyalgia. Any other medical history I should know of?
Not that I can just think of.
Yeah, no, that's fine. Okay, so next I'm going to ask you some questions that will help me to get to know you better. First of all, what's your dominant hand?
I'm right-handed.
Okay, so the side you injured. What's your job?
I'm an accountant.
Okay, and who do you live with?
My wife and my teenage son.
Okay. Due to your injury, are there any activities in your daily life that you're having trouble with?
I have trouble anytime I try to use my computer, anytime I try to use my phone, washing my hair, putting together like puzzles, or anytime I try to like reach like for cabinets, stuff like that.
Okay, we're definitely going to look into that today. So it sounds like you're having trouble with the occupations of work, ADLs, IADLs, and leisure. So we'll definitely address that in therapy. Also, some things that I need to consider as your therapist is due to your diagnosis of fibromyalgia, you experience a lot of pain, so that could affect our treatment sessions. Also, due to your nerve injury, you're going to have some decreased sensation, so that'll affect what modalities we can use in therapy. So before our range of motion exercises, you may not be able to have heat or cold to warm you up. And additionally, since you're only 4 weeks out from your fracture, you've been cleared by your physician to complete some active range of motion, but we will not be able to do strengthening exercises yet, probably not for another 4 weeks. Okay.
Okay.
Are you ready to start the evaluation?
Yeah.
Okay. So first thing, I want you to tell me, what is your pain on a scale of 0 to 10?
I would have to say like an 8.
Okay. Excellent. So now we're going to stand up and I'm going to observe you. Okay, can you hold your right arm out for me? Okay, so I'm seeing some wrist drop here, which is consistent with a radial nerve injury. It looks like you might have some radial nerve palsy, which luckily that usually has a spontaneous recovery, so that's nothing to be concerned about. Next, I'm going to measure your range of motion since you said you're having trouble reaching. First, can I see with your unaffected arm, can I see your range of motion? So first I want you to lift it straight up as high as you can. Excellent, that looks normal. Now out to the side as high as you can. Okay, can you bring it back for me? Oh, wow. And then I want you to bring it straight out to the side and then across your body as far as you can. Good. So your left side looks normal. You're not experiencing any issues over there. Okay, so now let's see your right side. So first, I want you to again bring it straight forward as high as you can. Okay, so it looks like there you're only at 85 degrees. So next, I want you to bring it straight out to the side as far as you can. So again, you only have 85 degrees of motion. And then last, bring it out to the side and across your body as far as you can. And again, you're at 85 degrees of motion there. So 85 for all ranges of motion for the shoulder. And so that's okay, you're only 4 weeks out. That's something we're gonna work on. So the last part of my evaluation, since you have some nerve damage, I kind of wanna see where that's at. So I'm gonna do something called Tunnell's test. And so I'm going to tap along your radial nerve from distal to proximal, and I want you to tell me where you feel tingling or numbness, okay? And so it's kind of a little bit of an aggressive tap.
Right there.
Right there?
Yeah.
Okay. Okay. So that's totally normal. Like I said, I suspect you might have some radial nerve palsy. but that should come back. Your sensation should come back spontaneously, hopefully. Okay, so closing remarks, I just have some few things to address. So I've identified 3 problems that I think we'll need to address in therapy. The first one is your lack of range of motion. So as I'm sure you've noticed, your right arm, shoulder has significantly less range of motion than your left, which like you said is affecting your ADLs. So we want to work on that so that you can get back to functioning. Also, something else we'll probably need to address is pain, because you have fibromyalgia, so you pretty much constantly experience pain. And then you also said today you're at an 8 out of 10, which is very high, especially for 4 weeks out. So we're probably going to need to address some pain management techniques and also maybe some activity modifications. The last problem, like I've mentioned a couple times, is it seems like you might have some radial nerve palsy. I would expect that to fully recover, but in the meantime, we might need to do some desensitization or activity modification again, since you're having trouble feeling things and doing tasks like puzzles and those fine motor things that you need good discrimination for. Sound good?
Sounds good.
Okay, thank you.